Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin.
Celebrating Labor Day.
He's a board-certified plastic and reconstructive surgeon. It's not quite Labor Day. We're a few days early.
What day is Labor Day?
I think it's the 4th.
Okay. I knew that.
I think it is, yeah. I could be wrong. I've been wrong many times before, and I will be wrong again. If you are listening to this episode and you would like to watch it, you can find us on social media at Jason Martin MD and at Beauty and the Surgeon podcast. We're on YouTube. This is part 2. So if you missed part 1, I definitely recommend going back and listening to it, because in part 1 of everything you need to know about lower body lifts, we talk about who's a candidate, how to choose a surgeon, and very important slide about the risks and complications. So definitely go back and listen to that one, either first or listen to this first and then go back and listen to it. But either way, it's a good one, so don't skip it. So in this episode, I always feel bad saying like we're gonna get into the meat of the issue, because like it sounds wrong to talk about meat when we're talking about doing surgery. Like finding a piece of face on the floor that you thought was pretzel. But we're
That's definitely happened.
It has definitely happened. That is a true story.
Did the lady who was a tailor say it was like a bodysuit or something?
Yes, her bodysuit alterations.
Bodysuit alterations.
Yes. But we're going to talk about the specifics of this surgery, how it's done, and we're also going to talk a lot about recovery, because that is really the biggest part of this surgery, is the recovery part.
Yeah.
Yeah.
We're going to go through, pre-op appointment.
Yep.
Never mind. You go first.
Yeah. So we're going to talk about the pre-op appointment. In our last episode, we talked about what to expect at your consultation. And I read this in that slide. I'm going to read it again. The success and safety of your body lift procedure depend on your complete candidness during your pre-op appointment. You will be asked many questions about your health, desires, and lifestyle.
And be honest.
The complete candidness requires honesty.
Yeah.
So at your pre-op appointment, we're going to go over your health history again, and this is where the candidness comes into play. You need to tell us everything you're doing, taking. We're going to go over your health history, medications, also give you probably a requisition to go get blood work done, perhaps an EKG if you have not had one and you're over the age of 50. Have you sign consents, take your pictures, lots of pictures, collect your payment, give you your prescriptions, review the time of day of surgery, and answer any questions that you have. There are some important questions to ask at your pre-op appointment if you have not asked them already. I think this is a really big one, is where will I be taken after surgery? Like, are you going home the same day? Are you staying in the hospital overnight? When do you get to leave? This is an important thing to know. Going over the medications you've been given or will be prescribed. Will you have dressings, bandages, and drains? How will they remove? When will they be removed? When can I shower? When can I drive? We're going to talk about that in the recovery section. And when can I return to normal activities and exercise?
Can I ask a question about this?
Yeah.
Pre-op labs. Why are pre-op labs important with the body lift?
They're important with any surgery. So,
why especially with this surgery? Because blood loss with this surgery is probably greater than almost any other plastic surgery procedure we do. If you start out anemic or you have low blood levels and you do this surgery, theoretically speaking, you could be putting yourself at risk for much worse anemia.
Or if you have very high blood glucose, like hemoglobin A1C is too high.
Your hemoglobin A1C is too high. Your fasting blood sugar is high. These are problems. You
don't clot normally.
Yeah. If your PT or PTT and INR are elevated or not normal, you come in hypertensive. I mean, you could even argue that getting an EKG, even if you're less than 50, on some of these cases might be necessary. So
depending on the health history, for sure.
Depending on the health history. Yeah. So if you go into these offices and you feel like, wait, what's all this workup going on? I mean, they're doing that for your safety, for this surgery specifically.
Even electrolyte status. I mean, things like that can just drastically shift how your body processes fluid.
Right.
So if you're doing a big surgery like this, as we talked about in our previous episode, persistent swelling of the lower extremities is something that could happen. And if your electrolytes are way out of whack, it could happen even more.
Yeah.
So, and make sure your blood clots normally too. Again, it's a long incision. You want to make sure your blood is clotting normally, not too quickly, because that puts you at risk for blood clots, and not too slowly, because then you're going to be oozy and bloody everywhere, and that's not good either.
So preoperatively optimization, Amy's not only an expert in pooping, but she's an expert in preoperative optimization and supplementation around surgery, which we're going to show you. This is one of my favorite episodes ever. And
the 2.0.
Yeah.
There's no reference to the pooping thing, so people.
Yeah, we don't talk about it. Like Nils is like, "What are you talking about?" Like, we've never talked about pooping on this.
That was like podcast. 2 episodes, like a month ago for our listeners.
Okay, that's fine. So, for those who weren't watching the last episode, she's a pooping expert. Anyways, I do think that optimization for the surgery is important. I think you would agree with that.
Yes, and we cover that extensively in part 1 as well.
Yeah.
Yeah. All right. So this is what everybody's here for. What are we talking about here with body lift surgery, Dr. Martin?
It would be hard to do a body lift surgery under local anesthesia. It would be really hard to do it with local anesthesia and sedation, even though it's possible. I think most of these cases are going to do it at a accredited Quad A facility because it's going to be up to a 6, 7, 8 hour case in some cases.
Depending on the size of the person.
Right.
So step one is anesthesia.
Yeah,
is what he's getting at.
Well, let me finish if you want. So I'm going to do what you do to me. So you get general anesthesia. You're not going to get local anesthesia alone. General anesthesia means there's going to be a tube in your throat to help you breathe. It's going to be heavy medications to keep you asleep, and even muscle relaxants or paralytic drugs. Okay. So this is like serious surgery. Secondly, the reason why you have to go to a facility like this is that the insensible losses and the bleeding and everything, you need a lot of hydration and resuscitation with this.
Monitoring. You need continuous monitoring.
So you need an anesthesiologist, board certified, or a CRNA who specializes in these kind of surgeries. They need to have a Quad A facility with all the medications for helping you if you need help, and nurses that understand what they're doing. So anesthesia is going to be, in almost all cases, general anesthesia.
And there's a good point there is that you are prone for at least half of this procedure or part of the procedure, which is laying face down.
Such a good point.
And that requires a specialized type of anesthesia, and monitoring.
Yeah. So you put a tube in your throat, right? When you put a tube in your throat to bleed.
Don't do it to bleed.
Hopefully not to bleed.
No, if there's blood coming out of your intubation tube, something's going wrong.
I've seen it.
Yes,
I've seen it.
And something is going wrong.
I was giving the anesthesiologist the stank eye.
Right,
he's like, it's fine. I'm like, it doesn't look fine.
No, that's not
fine. So if you are in a prone position or you're face down, it changes the physiology of how you absorb oxygen and breathe.
Well, and even how your lungs are able to expand differently.
Exactly, Amy. So also you're putting yourself in a face down position when you're totally asleep. So supporting your neck, supporting your body, you're in a face down position for a long period of time. As Amy said, a couple hours. Then your face is actually on a cradle that can have
cushion.
That can have problems. If your face is not supportive, you can have ulcers or bruising, skin loss, tissue loss. There's so many things with this surgery that could cause problems.
Well, and like the abrasion too from the mask when you're face down,
your
like if it
eyes,
was, the soft
just
tissue.
eyes alone, you get corneal abrasions. It's just so important that you go to a place where the anesthesiologist, the circulating nurse, and the scrub tech have done these surgeries before. But anesthesia is going to be general because you're probably most likely going into a prone position. I'm sure someone watching this has had a body lift under local with sedation.
I don't know about that.
Yeah, I bet you they have.
They probably have, but I don't think it was probably by, it was definitely not by a board certified plastic surgeon.
No, I mean, it's possible. You could do it. With enough sedation.
Or should.
Well, the problem is to get to the point of sedation where you can actually tolerate it, you're basically doing general anesthesia. Right. You might as well put a tube in it because it's more safe.
It's safer. You're putting less drugs into them at that point. I mean, it's just,
Theoretically, you could do this with an epidural in regional blocks and be awake. I'm sure someone's done that too. The problem with epidurals is they don't.
Yeah, Nils is like, no.
Yeah.
Can and should are very different things.
They become dislodged when you turn. Sometimes it's for long-term use of epidurals.
I don't know if you could
great.
do an epidural with you could dislodge that so easily. That just sounds like a terrible
and then also
idea.
You're working in that
that's
area.
What I mean. That's a bad idea.
Yeah.
So you're going to have anesthesia. Let's talk about
General
step
anesthesia.
2.
Step 2 is the incision. So Amy, how would you describe the incision?
In what way?
Okay, well, if
you mean the location?
The location.
Okay, I'm like, because the incision itself, there's not much to say. You're cutting through skin. So it depends. It depends on the type of body lift you're having, and it depends on where the surgeon is starting. So if you're starting face down, you're obviously going to make that incision across the gluteal crease, kind of at the top of the buttocks, across the back. If you're starting on your back, you're making it low on the abdomen, down into almost the pubic area.
Which is it, Bert or Ernie with the eyebrows that connect together? Bert.
Yep, that's Bert.
Okay, so you know how the eyebrows go up and then back down again over the nose. That's basically what you do at the top of the butt.
Yep. It's like a heart, or like a little bead.
The top of a heart. That's a really good one. Yeah,
top of the heart.
So you just follow the demarcation of the upper butt with the back. And then how would you describe what we do in the front? It's more like a tummy tuck.
It is very much like a tummy tuck.
And
I would say it's exactly the same.
So it would go along the same location as the tummy tuck scar.
Yep, like kind of the bikini line. Yeah. And that, after that, the actual part of the operation, we talked briefly in part 1 that we were going to talk more about this. Liposuction, if needed, expound on why liposuction is really beneficial for helping to raise the flap.
Yeah, so liposuction, number one, most people that do body lifts have pockets of fat they need to get rid of. It's usually the saddlebags or the flanks, the upper hips, lower back, lower belly. And then so liposuction there really helps, right? It just helps with the results of the surgery. Secondly, when you liposuction, especially in the areas of the saddlebags or the lateral hips or the outside hips, and then along the abdomen and back, you can release the tissue and then also elevate a flap. So it helps with insetting, it helps with elevation of the flap, it helps with releasing the tissue so you can remove the unwanted skin and soft tissue to get that lifting effect.
Yeah, and something we didn't include in our step one, which is anesthesia, also includes the local anesthesia, which we do put in these areas. Even though you're asleep, still put local anesthesia everywhere we're working. So that kind of helps break up things too, kind of elevates the flap also when you're filling it with this tumescent fluid, which is numbing it.
A little bit inside baseball, but I think this might be important. If you're considering doing the surgery, we use TXA, which helps with bleeding or reducing hematoma risk. You can give that through the IV. So TXA, all 3 letters, all capital. And I'll sometimes even put it into the local fluid when I'm injecting it in. So that definitely is helpful.
Yeah.
So anyways, you have these incisions, the heart on the back and the tummy tuck scar on the front. You're using liposuction to release the tissues and also remove local pockets of fat.
Kind of thins down the flap too.
Right. And then you literally do the lifting motion. So if you're working on the back or the buttocks, you actually pull up towards your back.
Yep, like pulling on a pair of pants.
And you usually have an assistant there and you actually pull together and then you start systematically removing the excess skin and soft tissue.
Clamp it.
Yeah.
Take out the excess.
Take out the excess, move over a little bit more. So you inchworm around both directions to where you go to the table and then you do your insetting. Amy has step 4 here is closure.
Well, before that,
Oh yeah, I'm sorry.
Yep.
I was going to
Yeah.
say that for the closure, but
Yeah.
that's what I was about to get to. You're like ahead of me. The closure reapproximation of the soft tissue is this whole surgery.
Yeah.
So you're going to take out the extra skin and soft tissue, but bringing things together so they just don't fall apart again or tear apart is really important.
And that's internal, like that's underneath.
Internally, deeply. And so there's something called the superficial fascial system. Don't need to remember that, the SFS, but that's just the deep layers of your soft tissue that aren't at the fascia overlying the muscles of the back or the belly, okay? So you're putting really, really strong sutures in there to bring the soft tissue that's below that you're lifting up and securing it to the soft tissue that's still there along the back or the abdomen. So that lifting part of it is how you get the lift, the body lift. And those sutures are what makes it possible. If you just closed the skin, like the superficial skin, it would all fall apart and it would be terrible.
I have a great analogy to describe that.
Good.
I was actually thinking about this a lot when I wrote this because I'm like, man, how do you explain that to somebody? So think of 2 things. You have a basketball and you have a pillow, a really soft pillow.
I'm liking this. I love basketball and I love pillows. Good.
So which one of those, if you wrap something around it, is going to hold its shape?
The basketball.
Correct. So that's kind of the same way with the body. Like if all you do is pull skin around something really soft, it's not really going to change its shape and it's not going to stay that shape. You could, it's not going to stay like you want it to. Whereas with the basketball, which is a hard surface, if you pull something tight around that, it's going to stay. Mm-hmm. So that's why it's important to get all those underlying tissues to the correct place also.
Right, because the basketball, analogous structure of the basketball is the muscle and fascia underneath.
Correct.
That is not lax or loose unless you have a hernia, but you know what I'm saying. So that's the strong part. That's the foundational part.
The skin then just flaps over it and stays flat like it would on a basketball.
So that deeper layer of the soft tissue, which is called the superficial fascial system, allows you to elevate all the whole lower body. I mean, that's so misleading because you're not elevating the lower body. The
area of surgery.
The area of surgery. Thank you.
Yeah.
I hate saying that because a body lift is almost a misnomer. It's basically like a butt and upper thigh lift.
That's why we called this the lower body lift.
Okay,
yeah, not the leg lift. Like this is kind of just the lower body, the lower trunk. We call it the lower trunk lift.
Lower trunk and butt lift.
Which is also the trunk.
With a little bit of the thighs.
You got to lift that trunk.
You got it. Thinking Black Eyed Peas. My lovely lady.
What you gonna do with all that junk?
Junk in the trunk.
Yep.
You get in my head, it's like a mind virus, and it doesn't come out.
I feel like we haven't had a good hip hop reference in a while, so this was good.
I know. We're like getting too old.
Yeah.
now.
Yeah.
So, anyways, those deeper sutures is a big part of the case. So
They're key to the results.
And then if you're going to someone who's an expert at this, they know how to do this kind of stuff, just so you know. By the way, it's very analogous to thigh lifts too. Same kind of suturing, same kind of pulling up, securing it to areas that have structure to it, so it stays where it's supposed to be, doesn't spread apart, and doesn't fail for the surgery itself.
Yeah.
Redrape skin, close it.
Oh, you missed one.
Place drains. But I thought we'd do this without drains, Amy. Drainless surgery.
You're going to have drains with this surgery. You will have drains.
I am flying into the OR on my unicorn.
Yeah.
Without drains.
You will have drains. So we place the drains as part of that that's part of the closure before we get to the skin, which is kind of what, then the next step.
Skin closure is pretty similar to anywhere else. We do use a lot of staples on top of our closure as kind of an insurance policy.
Especially across the back.
Those come out usually within 7 to 10 days and won't leave the track marks. But you'll see surgeons will do this because it really does give you an extra
especially those first
protection.
few days.
Yeah.
Yep.
So when you try to bend and do something stupid, it won't just fall apart.
Yep. Well, it's habit at first, right? We're used to being able to move in a certain way. And so the tendency is to move in that same way. And if there's nothing stopping you, you could damage something, where it's those staples, man, they keep you in place.
They do.
Yeah. And then we wrap you. So put some compression on you, probably a binder, maybe some ace wraps, depending on where you had surgery, and wake you up.
Yeah.
And then the hard part begins, which is what we're going to talk about when we come back from our break.
Right. I will say that's about, in a lot of cases, around a 6-hour surgery.
Easily. This depends on the size of the person. It could be 8.
And it could be longer, it could be less. If it's 2 surgeons working together, a lot of offices that do these surgeries, they combo it up.
Yeah.
And so you could maybe get it within 3.5, 4 hours, maybe.
If you have a really awesome OR staff too.
Good OR staff, 2 surgeons working at the same time. Yeah. So me alone.
With an average OR staff, average flip time.
I could do it probably in 5 hours.
Depending on the size of the person.
Total surgical time. Yeah. For a Colorado type patient. If it's someone with excessive skin and soft tissue problems, that could be 8-9 hours, honestly. And that would probably be at a university setting anyways.
Yeah.
And the last thing I'll say, because we're going to talk about recovery, there's going to be some surgeons that admit these patients overnight.
Or for 2 nights.
And that is not weird or concerning.
No, you're going to be happy you stayed.
Yeah.
Like you're going to want to stay the night. Like you will not want to go home.
It's 2 reasons for that. It's for hydration, IV fluids, because it's hard after surgery. You're taking pain medications, you're in a lot of pain, and you can't drink anything. So you become dehydrated, which is terrible for recovery. And then also it's for monitoring and pain medication. Yeah. So monitor, make sure you don't have wound breakdown or hematomas and you're able to
ambulate, you're able to avoid all those things.
So if you go to your surgeon and they want to admit you, I don't have a problem with that at all.
No, I would say you should expect that to stay at least 1 night. I wouldn't feel comfortable with somebody going home. And it might be the
surgical facility you stay a night.
Yeah, that's what I mean.
It's not like a hospital.
No, you're going to be staying at least 1 night under very close monitoring. And honestly, I wouldn't. Yeah, we wouldn't discharge a patient right after surgery.
Right.
They're going to stay at least overnight. Yeah. All right. We're going to take a break. We're going to come back and talk even more about recovery.
All right.
And we're back, and now the work begins.
Not for me, because I'm at home. Nils and I were joking about this. I'm at home on the couch, chilling out, watching Netflix.
This is where you and I become best friends, because you are going to see me and talk to me a lot. I say that to people after surgery. I'm like, oh, like you're going to see me a lot.
You are.
And that is very true of this procedure. So the best thing you can do is preparing yourself in advance for recovery, especially for a surgery that's this involved. This is true of any surgery, but for this surgery specifically, you're going to need a little more than most surgeries. So make sure you have thoroughly read through your post-op instructions and review those with your primary post-op caretakers. This is so important because there's nothing more frustrating than having someone taking care of you after surgery who is terrified, right? They think every little thing you're going to die. The person who had surgery probably read their instructions and they think they're fine, but the person taking care of them doesn't, so they're constantly freaking out about
And
everything.
everywhere they look, they see an incision
Right.
on your body.
Yep, and they're scared, and then
Yeah.
that just makes everybody unhappy. So make sure that whoever is going to be with you after surgery has also read your post-op instructions, so they know what to expect, at least a little bit of what to expect, or what to expect that's not okay.
Especially with the drains.
That's my next one. Prepare for drain management and incision care. Because this surgery has an incision that goes all the way around you, you may not be able to reach parts of it yourself comfortably after surgery. So you're going to have to rely on somebody to help you. And you might have drains on a part of your body, like in your back, that you can't really reach yourself. So that person taking care of you needs to be prepared for that as well. This is not the time for your most squeamish person to be around you who's going to be grossed out by your drains or won't touch your incisions, like won't put your, topical first aid gel on. Like, this is not the person you want. Like, they need to be prepared. There was
What
a time.
if you didn't know, and then you get to it, and then they're the ones that won't touch anything?
Well, that's why they are prepared in advance.
Okay.
This is all about preparing in advance.
So you got to be very specific. Are you okay with taking gloves and antibiotic ointment and putting on areas that look scary and maybe bleeding?
Yeah.
We should make a VR training for recovery help, so they know what they're getting into. Right?
With the meta glasses?
Yeah,
Yeah.
They put them on and they get to see all the things. And like, if this bothers you, then
This is not for you.
Note. Yes.
Walk them through it.
Yeah.
I love it.
Know when and where your first post-op appointment will be. It may or may not be at the same place you had surgery. It probably won't be at the same place you had surgery.
Right.
For us, our first post-op appointment with patients is via video because we don't
Telehealth.
want patients who just had a body lift getting in and out of a car any more than they absolutely have to. So they already, they made it home. We don't want them getting in a car and potentially needing to deal with like walking up and down stairs and getting in and out of a car multiple times just to come in and see us when we can do that all via video. So fill your prescriptions, please. Please fill your prescriptions.
Why is that, Amy? Why?
Just please fill your prescriptions.
I'm so confused.
Before
What are you
surgery.
talking about?
Yes.
But you gave me the prescription. Why do we have to fill it?
Yeah. My pharmacy has it. Why do I need it? Purchase any recommended post-op products. This is probably going to include some garments, pillows, ice packs, maybe even like at-home SCDs or compression garments for your legs. Purchase all the things your doctor recommends. The pillows to facilitate better sleep. It is so key. After this surgery, you've got an incision that goes all the way around you. So you're not going to be comfortable sleeping in really any position. Your doctor's most likely going to want you to be in a supported position on your back. That's not going to be super comfortable unless you have a lot of support pillows. Even a recliner, and people always want to do a recliner. I'm like, I don't think a recliner is going to be your best bet because the recliner puts pressure on the sides too. And like, it's hard to get in and out of.
Do people have recliners these days? I just want.
Yes.
Okay, I know I'm like completely disconnected from reality sometimes, but like that's a common thing. People are just going to the store getting recliners. I know it was when I was a kid.
Yeah.
Okay.
You can get the ones now that stand you up.
You
as
can,
well,
the
that,
assist
tilt you
ones.
all the way to you.
And that actually would be a good thing to rent.
Yeah.
That actually would be something I would
So
recommend renting.
that's what I was getting at. So can you rent recliners?
You can rent recovery recliners, yeah.
Okay.
And the hospital chairs, the hospital recliners do the same thing.
Okay,
They'll
that's
actually
great. Then
lift you
that's
up.
what people should do then.
Yeah, lift chairs are.
Yeah.
That is something I would recommend for a body lift for sure. Think about things you use on a daily basis and move them as close to weight height as possible, or weight level. Sorry, not weight height, waist level as possible. Weight height. That's what I said. I said
Yeah.
weight height. Waist level.
So wait. I just want to reverse. So you said weight height for waist level.
I did.
Okay.
I sure did.
I didn't know that term. I was like, waist.
That is not a real
Weight?
term. But Nils heard
She
it.
said it with confidence,
Yep.
though, don't you think? It was kind of like, yeah.
Yep.
You got to be close to your weight height.
To your weight height.
I'm always looking for bloopers. So
Yep, that you found one. Yeah. And this is because, even like bending over is not going to be something you want to do, but even reaching up is also not going to be something you want to do.
There's nowhere you can go.
No. So
You're stuck.
Waist level is where you want things.
Yeah.
Plan on a few days of loose, button up, easy to put on clothes and shoes, slip on shoes. This is not the time for shoes you have to tie. Absolutely slip on shoes.
You have to have your zip up FUBU or like our things that Nils did for us, you and I.
Oh, our
both.
tracksuits.
Our tracksuit right
Our
here.
tracksuits, yes, our recovery tracksuits. And it's normal to be nervous and excited. So part of preparing for recovery is knowing that it's normal to be nervous and excited, but being well prepared should help somewhat with the nervousness, at least that part of it. You're gonna be much better off if you're prepared. This is where we talk about the length of recovery.
I mean, they have literally
This
a
is
paragraph on this.
directly from the board.
Wow.
I'm going to read it. And it is a full paragraph.
That's crazy.
And I actually,
that's not normal, right?
I made this shorter. Well, this is not a normal recovery.
I know, but this is not normal for them to have this much verbiage.
The only other one that they have anything near this length on is about explant surgery. And I did read that in the explant because that's the only other time I've seen one that's this involved, but this is the most involved. So I'm going to read this. The results of a body lift surgery are visible almost immediately. Mm-hmm. However, it may take 2 years or more for the final results of the body lift procedure to fully develop. Some visible scars will remain, but the overall results are long-lasting, provided you maintain a stable weight and general fitness. As your body ages, it is natural to lose some firmness. However, most of your initial improvements should remain. Although good results are expected from your body lift surgery, there is no guarantee. In some situations, it may not be possible to achieve optimal results with a single surgical procedure. And another surgery may be necessary.
Highlight.
Yes.
Yeah.
Following your physician's instructions is essential to the success of your surgery. It is important that the surgical incisions are not subjected to excessive force, motion, swelling, or abrasion during the time of healing.
Yeah. Yeah, I didn't say that. I'm so happy you read this because body lifts rarely are the full answer.
Right, to the whole body. I mean, I think that's where you were saying it's a misnomer. It's a lower body lift.
It's a lower body lift that is not even the whole lower body.
No, just the trunk.
Because if you need a thigh lift, a lower body lift's not going to solve the problem.
It's also maybe not going to fix your entire abdomen if you need a full tummy tuck.
Right. And most people that have lost enough weight to need a body lift need a full tummy tuck also. So, and then you probably need your arms done. You need your medial thighs.
If you're a woman, you probably need a breast lift.
If you're in our age groups, I'm just grouping myself.
You also need a facelift.
You need a face and neck lift.
Yes, you do.
Early.
Yes, you do.
Early. We don't need it now. Early.
Yeah. I need it now. Yeah. So I thought this was great. And this is where expectations, and we talked about this in the first episode, having realistic expectations is part of being a good candidate for this procedure, because as much work as you've put in to lose the weight, if that's what brought you to a body lift procedure, you want to believe that you're going to achieve some magical results through maybe just one surgery. And it's important to be realistic about what's achievable with surgery. Right. And it's what's achievable with one surgery. It may be 2 or 3.
Right, because you probably need 2 or 3, and it's pretty hard to be able to do a body lift and something else. I mean, theoretically speaking, again, at primary institutions where I trained, maybe in an office like this with people that their body lifts are like mini body lifts, you could definitely add on something else. But if you're talking
something else small,
if you're talking about like someone who has massive amounts of extra skin and soft tissue, I mean, a body lift is probably all you can tolerate in one sitting. Yeah. And those are the people that need brachioplasties. They need thigh lifts, usually the vertical, potentially. Yeah. They need a mastopexy or a breast lift augmentation. So yeah, it's a lot of surgery. It's absolutely necessary. It's one of the most transformative things we do, but it's not, in most cases, it's not the only answer.
And it's not a quick recovery. So we're going to talk about everything from like the initial recovery to like loving your results. Initially, you're going to leave, get home, you're going to be swollen. You're going to have discomfort and or pain, bruising, swelling for sure. Temporary numbness or changes in skin sensation should absolutely be expected. The one question I get asked the most after even just a tummy tuck is, why do my hips hurt? But especially after a body lift, I think people are more prepared for that. But like, you may have discomfort that extends into other parts of your body just because everything gets kind of manipulated and you're moving differently. Like your back might hurt all of a sudden. Like
your face may hurt. Your arms may hurt.
Well, your arms are going to be doing the heavy part of the lifting. So things are just going to feel weird everywhere. Leaking and drain output, there's going to be a lot. Like those first couple of days, I mean, your drains are going to be almost filling as quickly as you can empty them sometimes. That's why having the person who's taking care of you, knowing about that is really key. Because that first 48 hours at home, you are going to need pretty much 24-hour monitoring. Like you're going to need help going to the bathroom. And actually, I say that. So week 1, let's just talk about what happens week 1. Unlimited easy walking. We want you walking. You're going to be taking pain medication.
That's our opinion, but that's correct.
Yeah, that's absolutely correct. Yeah. You can expect to be taking pain medication, at least over-the-counter pain medication, but most likely prescription pain medication for probably the first week, at least at, parts of the day.
Yeah. And then muscle relaxants for sure also.
Absolutely.
Yeah.
Yep. You are going to need 24-hour assistance with daily tasks, including going to the restroom, getting dressed, walking, pretty much everything.
And going to the restroom could be a bowel movement and you need help wiping.
Yeah, you might need help wiping. You might even need someone to actually physically assist you getting on and off the toilet, which you probably will need, potentially. So that, and I would say plan for that for a full week. Like that person taking care of you for the first week, like this needs to be their only job. They do not need to be going to work and leaving you alone for 8 hours. Like you need somebody with you the first week, in my opinion, for the optimal recovery. You're going to be having some type of compression, whether that's just an abdominal binder, maybe some leg compression, the TED hose. Those are things you can plan on for the first week. I think something that's absolutely critical after a body lift is making sure that you're doing foot and ankle mobility exercises.
So we used to say press on the gas and the clutch, but no one has any clutches anymore.
Nobody has a clutch, and they're probably driving Teslas that have like go-kart pedals. Yeah,
going back to the hypercars, maybe it's a hypercar, but they don't even have clutches anymore.
No. Yeah, so doing things that increase the mobility or keep mobility in your lower limb, in your foot and in your ankle are very key, in addition to walking. And minimal sitting, most of you sitting is not going to be a comfortable position, and we don't want you sitting at a regular like normal person sitting angle. It's a lean. You can be leaning. You can be reclined seating.
It's like going to the movies, those movie seats that go way back.
The movie seats, the lowrider cars, like that leaning, like reclined is your position. Like sitting upright is not it.
Like a tense hammock kind of sit back.
Yeah, like a beanbag chair.
Yeah, beanbag chair. Yeah, Adirondack chair.
Oh gosh, even just saying Adirondack chair in my mind, thinking of somebody who's recovering from body lift.
It would be so terrible.
That sounds like torture.
Yeah.
Yeah.
I'm just talking about the angle, but the thought of you sitting in it.
Yeah, no. Like literally all I feel like is like hardwood on like a healing wound. Like,
the beanbag chair, I mean, how would you get out of that?
You wouldn't. You'd be stuck there forever. You'd never get up.
Yeah.
Don't sit in a beanbag unless it's on an elevated surface.
Right.
Yeah. Anything else on week 1?
No.
Yeah. Weeks 2 and 3, you might get you'll have your drains removed probably by the end of week 2 in most cases. But I tell people plan on up to 3 weeks of drains, because in your mind, if you plan on longer and they come out sooner, that's great. While your drains are in place, you can't shower. So that's why I tell you to plan on longer. And then when they come out early, you're happy. Weeks 2 and 3, you're still going to need some help with daily tasks like cleaning your house, vacuuming, laundry. Those are things you're going to need help with. Anything that requires a lot of bending and twisting, dusting even. You're going to be just stuff that is close to you that you can reach from your, what do I call it, waist height? I mean, your waist height from your waist level. But you will be feeling much better. You're still going to be moving kind of slow, but you're going to be used to it by now. You'll be feeling a lot better. You might be cleared to drive at this point.
I don't know about that.
Depends on the position of your car. And again, you got to be the low rider. So with the assistance of the bombshell booty cushion maybe, or just the way you have your seat pillow adjusted, by 3 weeks, I think most people would be okay to drive.
Yeah, maybe 3 weeks. You got to be off pain medication, and you don't want to be driving. All of a sudden you have severe pain and you jerk the wheel. That would be disastrous.
Yeah. Well, and even just getting into the position to drive might be prohibitive.
You get like a Ford F-250 where you kind of walk up into it, maybe. I don't even know.
You need a little ladder to get in.
Yeah.
You're still going to be doing compression. Your compression is likely going to change at this point. When your drains come out, you can do like smooth compression, which is really nice. We want you to continue walking. Still minimal sitting. Sitting is still not your friend.
Man.
Yep. And that's 3 weeks. So we're going on a month now.
God, we're already at a month.
Yep. So you've been doing this for a month. You've been turtling for a month.
Oh, no.
By this point, though, weeks, and I put this as weeks 4 to 12 because this is a process over the next 2 months after surgery. You made it through the first month. You're doing great. You're still in the acute recovery phase in my mind. The next 2 months, you're going to start returning to most of your pre-op activities. Not exercise. I said daily activities. So things like driving, things like doing light housework, those kinds of things. You will probably be cleared to resume easy upper body exercises, nothing where you're hanging from your arms, but if it's not putting pressure on your incisions or stress, you can, resume some upper body stuff. Sitting as tolerated, and that is a process over the next 12 weeks. Maybe starting some topical scar treatments and just walking. Lots of walking.
Lots of walking.
Yeah. You get to the 12-week mark, 3 months, you're a 3-month-old, you get your 3-month-old body. This is when you can start to resume all your normal exercise and activities, provided you have had normal wound healing. So
that's a big if.
That's a big if.
So look up the complication rate after these surgeries.
It's very high.
Yeah.
But it's based, you think of the percentage or every inch of incision, your risk of every risk goes up. So you have, let's take a breast dog where we have a 1-inch incision, risks are really low.
For the wound itself.
Exactly. Yeah. That's what I mean. For the actual wound, like it's so tiny. I've said like rhinoplasty. It's like 1/4 of a centimeter.
Yeah, I don't think we've ever had a problem with
like they're totally fine.
Yeah.
But you get 36 inches of incision, like almost as long as this table. Like your risk goes up.
Yeah.
So more importantly, though, and I mean, you could love your results even in week 2, because even with as arduous as I may have made this recovery sound,
Totally worth it.
even the board says the results of a body lift surgery are visible almost immediately.
They're crazy.
Because it's gone.
Yeah.
Like, it may suck and you may be in pain, but when you look down and can see your feet and not just skin, I mean, that's immediate. And like that, you got to keep that at the forefront of your mind.
Patients are really happy with these results.
Yes.
We've seen, patients from other doctors, the results are average.
They still love it.
They love it.
Because it
got fixed all, a lot of the problems they had, maybe their scars weren't perfectly symmetrical. They're like, I don't even care.
Is that better than the skin?
Yes.
Yeah.
In their minds.
It's better in everyone's minds.
Yeah.
Yeah. So I think I don't want anyone to be scared, but I want them to be realistic. Like, don't think that you're behind schedule when you are still recovering at 10 weeks.
And we're definitely going to get a comment from someone who did a body lift and they did it under local anesthesia, and it's the easiest, recovery ever.
They took Tylenol for a day
and
they didn't have drains.
And I love that. And I give mad props to those people or person, but that's not reality. What we talked about today is pretty much a universal reality for most people.
Yeah.
If we're talking about a full lower body lift that is circumferential and involves a lot of lifting, a lot of liposuction.
Yeah. An episode that you should absolutely listen to in addition to these, if you're considering a body lift, is our tummy tuck myths, because we talk a lot about swelling in that episode. And that is something that you can expect from this as well. And the swell hell. And that's the part, I think, again, that's what gets in people's heads. I think people they hear the story of the person who recovered so quickly, and then they think there's something wrong with their recovery, when in fact their recovery is totally normal. And like, all these things are expected. Like, it's going to take a while. You're going to be swollen. You might not drive a car for 3 weeks. Like, that's normal. Like, you're doing just fine.
You're doing fine.
Yeah. And your doctor's office is now your best friend. It is after surgeries like this. Most of our surgeries, like anytime we're seeing someone for a long time, for an extended period of time, that then when I'm like, well, I'll see you in like a month, and I'm like the following week, I'm like, where is this person? Because it's just, you get so used to seeing them every single week. And then and then I tell them, like, and I always joke that like the leash is getting really long, like extending the leash a little bit. I'll see you in 2 weeks.
Yeah. But you do get a feeling you're kicking
Call
him
me
out
if
of
you
the
need
nest.
me.
I know, a little bit.
Yeah. So
it does have that feeling.
It really does, but that's, we want people to be loving their results and living their life and not needing to see us. But the fact is, you'll be seeing us a lot, at least for a little bit of time.
Right.
And then you'll be fine. And then we'll miss you. And eventually you'll come back and do something else, maybe.
So body lift is an awesome surgery. It's probably the most transformative surgery we do. It's definitely the one with, if not the longest, but close to the longest. In most cases, the longest incision. So as Amy said, that was a really good way to put it. It's so long that you're going to have a higher risk for scar-related issues, and associate with that how hard you pull with dehiscence or stretching of scars or open wounds or problems after surgery. So, that's just real talk, but it's amazing.
It's worth it.
Yeah. I remember doing these like at a primary center. And this is one of the first surgeries that I remember feeling tired. You're young during training, and you just have so much energy. It was like one of the first times I was like, this is a lot, even at a young age. You get a lot more efficient as you get good at this surgery, and you find ways to kind of work through at a steady level, get into a flow state almost, and you're just kind of plodding and going and going. Like today, to me, I didn't feel quote unquote tired when I got done with that long surgery. But this is involved. And the same thing that the surgeon feels with surgery, you're going to feel afterwards.
Yeah.
So just know that everyone's sacrificing here. But the results are truly amazing. So anyone watching this, as long as you watch this whole thing and know that we're telling you the truth, do it.
Listen to part 1.
Yeah. As
There's
long
there.
as you're healthy, you're not smoking, you're not diabetic, you're not hypertensive, you're focusing on your nutrition, you're not cutting or trying to actively lose weight, and you're a candidate for the surgery. You won't regret it. Do it.
Yeah. All right. Well, we appreciate everyone for listening. If you made it to the end of the episode, we appreciate you an extra lot. We would love it if you would like, comment, share. Definitely share this episode. There are a lot of people out there who need this information, and who might be feeling bad about themselves or their recovery. Even those people, if they've already had the surgery, they still probably would benefit from listening. But
right.
You can leave us a voicemail at this number here, 303-630-9038. And you can find us on all social media platforms at Beauty and the Surgeon Podcast and at Jason Martin MD.
Don't forget about TikTok.
I said all.
Okay.
I said all.
And next time is the big 200.
Next episode is our 200th episode. Cue the fireworks.
Woo!
Last time, I got a crown. Just saying, Nils. And I think Dr. Martin promised me a car. But I think that was more for us working together for so long.
Did I? I'd have to go check the tape.
Yeah.
I may wear a tuxedo. This is going to be a big deal. We really have no idea what's going to happen.
Yeah, it's going to be good.
All I have to do is listen to 200 hours of Beauty and the Surgeon to find out if you promised her a car. There you go.
Oh, I
Yeah,
know.
have fun
Well,
with that.
actually, he said, "What should I get you? Should I get you a diamond?" And I'm like, "Can I get a car?" So
That's what it was. That's
yeah,
true.
that's how it went.
Yes.
It went more like that.
Yeah.
Yeah,
Yeah.
so surprises to come. We'll think of some cool stuff to do, and appreciate all our listeners as always.
200 episodes. I mean, that's
Big
insane.
time.
It's crazy. Well, we will see you all here for episode 200.
All right.